Christy Pierce has been a registered nurse for 14 years and says she's never seen anything like COVID-19.
I wish that I could show you how sick these people were so that people would, these young people who are still getting together that will carry the virus but not necessarily be very sick from it will stay home.
Hospital procedures have changed in order to protect patients and staff.
So when we see a patient that's starting to change, we immediately have to start gowning up, whereas before we would just be running in the room. We would be, doing our normal things. Well, now we're getting prepared to go into the room because the doors stay shut. It's a negative pressure. It protects that patient, the other patients, it protects us, but we have to have our gear on. Because we can't take care of the community if we get sick.
Nurses have even stepped into new roles to allow their patients some precious FaceTime with family.
A couple of us have used our personal phones to FaceTime family members and let them see the patients because they just want to see them. They've been in here, sometimes they're on whiteboard in here for days and they can't come and they can't see.
Procedures at work aren't all that's changed. Going home comes with a new procedure now too.
I have a mother-in-law suite in my house, and so I shower out there, and when I'm finished, I have a Clorox wipe out there, a Clorox box, and I wipe everything that I touched coming in and coming out. Most of us are not taking the shoes that we wear here into our house. They're not leaving our car for most of us. We call them our Corona shoes. I have a Corona car.
But despite the stress and worry that comes with fighting this deadly virus, Pierce remains steadfast in her role as a nurse.
I cannot go into a patient's room thinking, what if I catch this virus and take it home to my family? I can't do that. I have to be present for my patient. I have to be focused on my patient. I can't be worrying about my risk. I have to know that the hospital has provided me with the appropriate PPE. I've put it on appropriately. Now I need to do my job.